Hi there, this is Dr. Bill Wyatt again with the American Orthodontic Society, and I'm coming to you from beautiful Glenrose. So if you're ever in Texas, come to Glenrose. We have dinosaur tracks here, and that's what we're kind of noted for. Uh, anyway, I'm going to discuss an interesting orthodontic case here. This young man has one missing tooth and one missing cuspid upper one, and one on the one side, and the other one is just really impacted. And it's a really good case to learn a lot from. And I treated it quite a few years ago, so I didn't get my super duper cuspid pressure deal shown in this case, but you can see it in many other cases. So let's go back here and take a look at this young man. Let's see, I'm going to have to get me a little dot to go on. And there we go. Here is his picture. Now this was back before beards and long hair, and this was a little odd looking back when we did this, but today he would be right in style around here. My wife wouldn't let me even grow a beard, so I need to shave sometimes. All right, here is his smile, and it is pretty bad. We're already into the case, and you can see where we're opening space here to get this tooth in place, and then the other side is missing a cuspid over on that side. I think the right side he's got a tooth, and the left side is a missing area. So let's erase those marks and go to his profile is good, and this looks quite well. Now here we come to the models where he's missing a tooth, and he's also got one that's impacted, and it's way up in the tissue. We'll go to the next deal. There's a lateral tooth there, but there's a missing tooth in that space. And this is 1983 when we were doing this. This is kind of a class 2 problem here. The lower jaw needs to be out further, but it's out in the front there. And looking at the model from the inside, you can see the two bicuspids in the lateral and the central. So this is just a missing tooth. Now over on this side, you see the center line is moved around to this area. So he's got a impaction down in here. And we're going to have to bring this out here and open the space and get rid of this deciduous tooth. And then we'll open this space and put a bridge in it back then. So let's get on with it here. This is where we started, and you go down and uncover this thing, and you take your electrosurge and kind of cauterize the tissue around there, but don't cut through like this. Leave some tissue around your teeth, but you can take a big place out of the palate and it'll fill in. And then we clean that up real good and cauterize it where it's not seeping fluid in there. And we have a hook made, and I usually make a hook and have it covered with bonding material. We etch this tooth and wash and dry and get it good and dry, and then put this hook in here with the excess bonding material on it. And then we're going to pull it toward a spot over here. Now on our new method, we'd come out here and we'd make a circle like that, and we would pull from a spring back in this area, much more efficient than trying to pull it over here with some type of elastic material. So anyway, you can look at those in impactions and that we started later on. Now here is the lower arch in 10 of 83, and you can see it's crowded. I can't see the whole area down there, but it has all the lower teeth. And here we started again. Now we have opened this gap. We took the deciduous tooth out, and we got a spring coming across here on a flexible arch wire, and we're going to bring something out and pull it to that spring, which is not too effective to do, but we were doing it like that then. Now over here we're opening the gap, you see, for the tooth on that side, and we'll put a false tooth in that area, and we're going to try to bring this other tooth out into this gap. Now all this looks pretty complicated, but I think you can do this. Now the midline is going to be way off to the I believe it was to the right, and I will show that a little later. Okay, go to the next slide, and we've got spring on this side where there's a missing tooth, and so we're going to open this up and try to put a bridge in that side. All right, the upper of the lower arch again, we've got a crowding over on this side, but we have plenty of room to open it. Now we'll expand the upper a great deal, and we'll expand the lower, but the midline is right here and right here, and it's going to take a lot of stuff pulling this way, and sometimes even this way to bring this midline over and bring the upper back to match up the lines. All right, here we just tied an elastic chain over here. This is not the most efficient way to bring this in. It's, if you take our new method, you come out here, you have a little deal, and you put a spring in here, and you pull it over here, and then have that dental floss come in here. That's the most effective way I've ever found, and it keeps a constant force on that tooth, and you can, I haven't found an impaction yet we couldn't bring in with that, putting that force on it. So anyway, look at earlier cases where we have impaction, and you can see that. I've got a whole video on it. All right, here this tooth is coming toward that space now, and you've got an elastic chain. We hook it up here, and then we come down and hook it into here, and we'll keep bringing it across. Now we've got to think about opening this, and you see the whole palate is shaped like that. Now we got to bring this back almost the width of a tooth down here. So what's this space open over here? All right, on the bottom it's kind of warped anyway, so we need to get our arch wires and develop the curvature of the arch down here in both of them. We'd have to change the shape of the arch itself in there, and that's not too difficult to do, but you can do that and have to have an upper and lower that match in the way the shape is. So we'll go on here to another. Now we're kind of pulling, I think the midline is getting better as we go along. Now here, again, we're pulling this tooth over to this side, and we're beginning to open the space over on the left side, and the right side's where the impaction is. Now, you can take all the time you want to the regular orthodontics going on or something like this. I'm not trying to, it takes long enough to go through the part I want you to really learn in here. So anyway, we got the tooth pretty close to the surface there, and we're opening the other side up, and our midline is kind of coming along. We're about here and here with the midline. All right, this gap we're opening with the spring. You see, we've got that spring really packed in this area. So it's going to rotate these teeth, but we have to tie them in pretty tight on the brackets and open up space that way. Now there's the impacted tooth, and we have put another bonded hook on it, which is nothing but a bracket. And here we're opening this, and this lateral's going down, so that we're tying this to bring this around as we bring that. So we're going to bridge this, and we didn't care too much. We should have let the root of the lateral be parallel with that as we go through it. Now the bottom part is pretty well shaped up, and you notice the curvature of the arch is pretty well balanced. You know, it was out of shape over here before, and you start working on that. So there's just a lot of things you have to think about while you're doing this, and I don't want to make it look so complicated that people, wherever you are beginning to do orthodontics to people, whether you're an official orthodontist or whether you're a general dentist or somebody doing orthodontics. I want you to learn how to do the very best orthodontics we can. So we'll hope that we're able to do that to some extent. Now we've got this tooth right in here, and we're pulling on it, trying to jump it over the bite right there. And we're coming there, it's a little closer look at it, and we're pulling back on it, and we'll get it right up there to it, and it'll jump over the bite, or we can pull it up over one of the others. Now the gap on this side is opening up. Now all the time we're doing this, we've got arch wires back here, you see, and we'll have the loop, and we push the arch wire in and tighten this loop up back here, so the arch wire itself is pushing in this way and also in this way, and we're trying to open the space over here. So the space we gain from the arch wire just pushing itself, we'll locate it in some particular spot, and over here too, on this areas. So this is what you're thinking about, and the center line is getting closer in here, but not correct yet. All right, we'll jump this over. Now we take this tooth, and we've got an extremely efficient way of rotating these teeth now. Like we'd put a little glob of acrylic down here and make a place to hook it in here, and we're interested in rotating it around like that. So you half hitch this elastic chain, bring it under this arch, come around and get it on the bracket, but not over the arch wire, and it'll spin almost anything. Boy, it'll turn around. So we've got a lot on that rotation of teeth. You can do the same thing over on the other side. I'm not trying to cover that this morning, but anyway, now the lowers looks pretty good. It's almost finished, but here we still don't have this So we come in like that and like this, and you could actually come in with a class 3 elastic over here, and you'll pull this arch over this way and this way until we get this pretty close. Or what's more important, try to interdigitate on both sides rather of the mouth rather than this, because you can have variation in the size of these upper teeth, and the midline really should not be on, but it's the interdigitation that you're trying to work toward on the sides as you do that. So anyway, we put this to move it around, and that's coming over to that side. This cuspid is, we finally got it. These little brackets, you can raise one of these wings up and it'll push down on it, and you can rotate with these brackets. So they're pretty good for rotating, and you notice I put the bracket off center a little bit, so as I pull this up, this will rotate around to some to that side. But actually, I want to press this down here. As this goes back to this side, we want to pull it back in this direction. Okay, let's see. Now, the bottom is pretty well lined up. This tooth is pretty close to being rotated correctly, but this needs to be brought out just slightly, and it would be better if that were bent in some, just a wee bit, but not all that much. All right, so the impacted tooth is pretty well taken care of. Now we have this arch to hold this gap as we wait, and there's no tooth up there, so we're going to have to put a false tooth in this, but we can take the legs of this archwire like this, and we can expand it. We can make the roots go one way or the other way, and open this gap and hold it open with what we call we've shown several deals on this type of archwire. It's either step up or step down. I mean, if you're coming around here or step up like that. Now that is an excellent archwire to learn how to use. You can make the roots go the way you want them to go in with a step down or step up archwire like this. And we've got videos on that showing you. So anyway, the tooth is looking pretty good over here, and there's our space. And so we're really, this bracket should be over on this side. And so I don't know whether they ever got this tooth rolled around properly, but I should have that bracket further to the medial there, and it would rotate, and then you've got to pull this root over, especially if you're going to put an implant in here. You'd have this root way back in here, and it's down here now. If we bridge it, it's not quite as important. And there we go. The bottom is finished up. The top midline is pretty well lined up now, and we've got the roots looking good, and the cuspid is in there. Now over here where we had no tooth at all, we took a plastic denture tooth and filled it in like that, put a bracket on it, and I've had these things where you put the bracket, when you put it in, you tied it in archwire, it would put a little pressure on the top of that and press it into the gingival tissue, and actually you can't see it. And I've even forgotten about it on cases, and you take this archwire out where this tooth just falls out with the archwire, you know. So I've had a young lady one time taking the archwire off and had a tooth like this, and the tooth just fell out when she took it. She screamed, or she thought she had caused the tooth to go. Very interesting thing. But you can take a denture tooth like that and cut it off in here and bond it on, tie it on there, and you use it to hold the space and everything during the time you finish it. I never did get that tooth lined up like it really should be. Now, here we go. Now, I'm going to go through the x-rays now from start to finish. We had 3 impacted wisdom teeth, and we had a lot of crowding in here, so we had good teeth in this area. If we had not, we could have used this tooth to fill in the gap. And up here we're missing one. Now this is the impaction laying up in here. So we're going to extract this, open this wide and drag that across there. And then this area we're planning to bridge. So we wrote this down on the Panorex that we took. Now you can do that or not, just the way I remember them. We got it open like that, and anyway we finish it. This root really should be about over here, but since we're bridging it, it's not going to make that much difference in there, so we have left it where it is. And this is 1990 now, and he has a bridge over on this side, and this tooth is in place here with got a little space in between there. Everything looks pretty good otherwise. And here it is. That was 1983, and you can see that impaction there on the cephalometric picture. And we've got our midline nearly corrected, and this is 1986, and we haven't got it totally corrected, but pretty much in class 1 relationship now at this point, 1986. And there the tooth is, and here it is. That's 1986. It looks quite good. And this is the finished part of the young man's work. And everything's lined up there looking pretty good. Now we use one of these little spring retainers down here. I do not like those things. I'd rather bond something on the lingual side of these teeth. It's much better to do that. Now here is the bridge. You see this is the crown here, and he's got a bridge on this side. And here's that cuspid that we brought in on the right side of the mouth. And this is a kind of a drawn out, and there's the bridge. It's not the prettiest one I've ever seen, but it's working pretty good. And here's the young man's facial structure, and there's his smile. And I appreciate you folks watching this. I hope you get something out of it you can use yourself. But don't look at this and think that you will never be able to do that if you're starting out. Now, a lot of you are really way into orthodontics, and this is no problem at all. You might pick up something from it, but you may know what to do. But this was done and is finished back in we finished it before 90, but this is after we had finished it for a while. So thanks for watching, and I want you to join our group and subscribe to our channel. And thanks again, and I'll see you in another video with that. All right, I'm going to say bye-bye.